Welcome everyone. First CHEPA seminar of 2024. Today we'll have Mike Wilson and Marcela Vélez who present about the impact of strategies to mitigate health-related misinformation in diverse settings and populations. And so we're going to present the findings from a living evidence synthesis. So for those who do not know Mike Wilson is a scientific director at McMaster's Forum. He's an associate professor in the Department of Health Evidence and Impact. Marcela Vélez is a senior scientific lead, innovative evidence products and Spanish outbreak at McMaster's Forum. Please, to you.
Thank you, Jean-Eric. So, as Jean-Eric just said, we're going to be talking about this living evidence synthesis that Marcela and I have been working on. As a note, it's great to be presenting with Marcela, who's a graduate of the Health Policy PhD program, supervised by me, and has now come back to work with us at the forum. And does everything evidence synthesis with us now. Oh, this seems to not be working now. Sorry, I'm trying to use the remote and it's not going.
You have to use the mouse.
Okay, it was working before.
Yeah, announcements.
Oh, there it goes. There. Okay, so just as a few project notes for this one, in terms of the funding, so it came from a CIHR grant for a project grant. It's one of those where they wanted to fund us. They gave us a little bit compared to what we asked for, so we prioritized this project as part of the larger set that we had originally proposed. We registered the protocol with Prospero, and then our investigator team includes myself, Marcela, and John as the leads. We have a number of government decision maker and system organizational professional leaders that work with us from FAC, CHLNet, Niagara Public Health, the CMA, PRO Public Health, and I think those are all the key organizations. And then we also have 4 citizen partners that are working with us who reviewed the proposal initially, also reviewing drafts, are going to work with us to provide some citizen-friendly products once we finalize this first version. And then we also have a number of researchers that are listed at the bottom who have a mix of evidence synthesis and expertise in misinformation. So in terms of what I want to cover today, or what we want to cover today, I'm going to start off by giving some background and context around how this is nested as part of a priority that came from the Global Commission on Evidence. Talk a little bit about what misinformation is and some terminology, and then give you a sense of what a living evidence synthesis is and why we think this is important in the broader evidence architecture as one initiative towards what we're trying to do with living evidence syntheses. And then Marcela is going to provide some key findings and then just very quick conclusions and next steps with any questions that you may have at the end. If you have any questions, feel free to put your hand up as we go along if you like. Okay, so in terms of context, we initially prioritized this project from the Global Evidence Commission. For those of you who haven't heard of it, it's something that we've been championing at the forum as the co-secretariat led by John Lavis, along with Jeremy Grimshaw at the University of Ottawa. And we have 3 priorities. The first is to formalize and strengthen domestic evidence support systems, to enhance and leverage global evidence architecture, and put evidence at the center of everyday life. So addressing misinformation came in content-wise from the last one around putting evidence at the center of everyday life, helping citizens identify and understand evidence to make decisions. But it also addresses this piece around the global evidence architecture and trying to provide a routinely updated evidence base about misinformation that any other groups could draw on to provide forms of domestic evidence support when they need to make decisions about misinformation. I'll give an example of that later. So for implementation priority 3, just so you get a sense of what I mean by that, there are 4 kind of different road marks along the way here, helping citizens judge what others are claiming, or more generally find reliable information on a topic to make evidence available to them when making choices, engaging citizens and asking questions and answering them with research evidence, and making evidence-based choices the default or easy option. But those are probably some of the hardest priorities as part of the Evidence Commission. But what undercuts this is the need to also address misinformation along this entire pathway. So that's the cross-cutting piece of this priority around putting evidence at the center of everyday life. So we wanted to make a concerted effort to at least start to bring in and synthesize the global evidence on the topic. So that was the nexus of the of the project. Some additional context, this just came out last week, I think, from the World Economic Forum, that listed misinformation and disinformation as the highest priority or highest global risk for the next 2 years and number 5 for the next 10 years. But I think when you look at these priority rankings, misinformation could relate to any or all of these things. So I actually think, again, it's a cross-cutting issue across many societal challenges, which is, again, why we're trying to pull together the best available evidence on how do we actually go about addressing it in a meaningful way. All right, some key background. So when we're talking about misinformation here, the definition that we're working from is inadvertent or misleading information, to which the public may be exposed and then share without intent to cause harm, as compared to disinformation, which is different, which is another common term which refers to more of a purposive strategy to induce false belief, channel behavior, or damage trust. So I think they're obviously intertwined, but the second one refers to the specific intent to try and spread this kind of information. From a health perspective, this is really important. I think, as we all know, after having gone through the COVID-19 pandemic, it can delay or prevent effective care. It makes people question what they can or should be getting. It can affect mental health. It can lead to a misallocation of health resources, whether that's through undermining decision-making or making things less clear about where we need to put dollars towards safe and effective treatments, or exacerbate public health crises. Arthur.
So how do you distinguish between misinformation and disagreement? Because I see, when I read the media, some of what people label misinformation, I agree. And some of them, it's because I think that the person saying misinformation simply disagrees with the person making the statement. So there's a lot of distrust that means it's something you may find credible, someone else may not find credible. So you may think that it's the truth, someone else may think that it's misinformation, and then you may think that the person claiming misinformation about something that you think of as the truth is in themselves providing misinformation. So how do you distinguish here between disagreement and misinformation?
Yeah, and that's a great question. And that's a challenging one to address. I would say, as you said, I think some of this exists on a spectrum. So there are clear-cut examples of misinformation where it's readily verifiable as not being correct as compared to what credible evidence or experts might say. So we'll take the vaccine thing, for example. Lots of disinformation or misinformation around the safety and effectiveness of vaccines, readily disputed through credible evidence from randomized control trials, evidence syntheses, routinely updated evidence syntheses. Whereas, as you're saying, in that middle, there's always going to be room for debate, right? For differing opinions on things.
But even on the vaccine side, so the people who refer to randomized controlled trials, their interpretations were sometimes, I thought, the true interpretations were actually going beyond the evidence. Like they would have 6-month trials and they would make claims that implicitly they're talking about harms at 3, 4, 5, 10 years out, for which they have no information. But I saw a lot of experts say, well, yes, we have the randomized controlled trial when they're refuting someone talking about long-term harms. So even the situation you're talking about, which seems black and white, there's gray.
Yeah. So, I mean, that's fair, Arthur. And I think there are, however, much of what we're talking about with misinformation really is talking about the spread of claims, I think, that are readily addressed as either being completely inaccurate and not in the gray area. Right. So I'm willing to, I mean, we can maybe come back to this idea around the gray area stuff later, because I think it can come in as a healthy debate point for some of the interventions. Okay.
It just strikes me in the literature, it's a key thing you're gonna have to deal with.
Yeah, absolutely. So it's messy literature. There's a lot of ways to think about this. There's also a lot of ways to think about in terms of practices of misinformation and how people spread or are subject to looking at it depending on, or vulnerable to it depending on who you are, kinds of information you're looking for, and so on and so on. Okay, so with all of that, our objective was to support some informed decision making about what are some best ways to actually address misinformation, however we want to define that, and routinely update that best available evidence going forward. So there's one central repository, high quality, robust studies about different types of interventions to address misinformation. As I was alluding to just now, when we're talking about misinformation, we're in our review, we're also acknowledging and focusing on the fact that it can affect some members of society more than others. So, for example, those with lower digital, numerical, or health literacy, cognitive skills are more vulnerable to misinformation. So that means that some can be exposed to health threats, leading to greater social and health inequities. A review that was done in 2021 found that the most vulnerable to health-related misinformation include younger people, those with lower educational attainment, racial minorities, and social media users. And then some other reports have also pointed out the impact on women, trans, and non-binary people, finding that it leads to feeling unsafe because of online health information and questioning, in that specific example, report whether they get the COVID vaccine. Another last bit of background, just that, as we all know, vaccines have been the most common topic of misinformation. But other common topics include things like reproductive health, substance use or smoking, non-communicable diseases, pandemics, eating disorders, medical. So it really spans many areas in health, and is, as I alluded to earlier in the context piece, a large societal challenge to tackle. Governments have been using a variety of strategies to debunk this misinformation, including things like fact-checking or economic incentives, some legislation strategies. But our point with this project is that we need to be able to assess and compare those on some outcomes, including behavior change, and also the rapid evolution of platforms for information sharing and the growth and innovation of misinformation actors means that any previously synthesized information needs to be updated with what's new, and it's going to have to be routinely updated to capture what's new and emerging, in particular with AI, because this is forming not only a route to propagate misinformation, but also a route to potentially address misinformation as well. So given that, that's our rationale for the need for this routinely updated evidence synthesis that we've taken on. So I've used the term living evidence syntheses. I just want to give you a sense of what I actually mean by this. And I mean regularly updated summaries of what we've learned from around the world from studies, including how it varies by groups and contexts, using typical evidence synthesis approaches to identify, assess, and synthesize evidence, and they can be used to address any types of questions. But the idea is that, and some of this content is from the Global Commission, is that funders in funding these types of living evidence syntheses need to ensure topic coverage for the big topics that we're facing, to contribute to that global evidence architecture, to reduce duplication. We don't necessarily need another huge review on health-related misinformation. I think there are other reviews that related to misinformation that might be needed. I'll come to one at the end. Supporting quality and efficient resource use, and then including how do we use AI, how do we use an open science approach so that others can draw on all the data we use in a living evidence synthesis. And as an example, I'll show you in a bit, our living evidence synthesis about addressing misinformation has fed into domestic evidence support very rapidly. Because we did this synthesis, we were able to feed it into an urgent request from the Privy Council office in Canada in one business day to give them information about how best to address misinformation. So having the global evidence architecture available means that we're able to then rapidly mobilize, contextualize evidence, pair the global evidence with local insights to provide that kind of domestic evidence support. And this is just our visual of what we mean by that in terms of how we're thinking about evidence support these days. So broadly, evidence demand on the top, so priorities, questions coming from those who are making decisions. People like John and me increasingly working at the middle in this coordination mechanism for demand and then coordinating supply of evidence to pressing questions, but using that global evidence architecture on the right to feed into local forms of data to provide contextualized responses, in this instance, that were relevant to Canada. So why use a living evidence approach? So it's not going to be the case that it's going to be relevant for all forms of evidence synthesis. Sometimes a one-off product is fine. In this case, it's very relevant. So we say that they're most relevant when the context is shifting. It may change the applicability of the evidence. So I think that's very much the case here. When the issue is also evolving, that could change the framing of the questions. And I think that's also relevant here because we've also started to think about misinformation related to political institutions, which is the next phase of this project. And when the evidence is being produced rapidly, it could change conclusions. So again, very relevant here. So that's why these three, at least two of these three, are usually in place to provide rationale for a living approach. The benefits for me is that you can use rapid review methods to stand up a first version in a window of opportunity for informing a decision. We usually call this producing a quick and clean enough first version for timely demand-driven evidence support. And then we can adapt that approach. We're using an adapted approach that streamlines traditional evidence synthesis processes, and that initial version could adopt a narrow focus, but then over time we can add enhancements. So in the next version, we'll provide enhancements to the original approach that we had to stand up together through that window of opportunity. So we can increase the scope, we can modify methods to use more robust forms of risk of bias assessments, and we can change the types of outputs, like new and different spin-offs from this that we can use to inform decisions. So as the example, this is the one that was made possible by having our living evidence synthesis in place. When we got a call from Privy Council Office to say, what do we know about misinformation, including the practices and interventions to combat misinformation? The only way that was remotely possible is because we had already done all of it. So in one day, we were able to pull together insights from 17 evidence syntheses, including our own, and then some others we were able to rapidly mobilize. Okay, so in terms of our methods, and then I'll turn it over to Marcela for some key insights from our findings. We used a systematic review of effects. We're planning on roughly semi-annual updates. We're trying to get this first larger version out first. We searched a number of databases that are listed up here. In terms of our PICO question, we were looking at the general population with stratification by different groups, specifically age, gender, and sex, and different social media users. Interventions were, we have a framework that I have in a second that I can go through. I think it's 9 different interventions for addressing misinformation that we pulled from the Broadbent Commission, I'm pretty sure, and it was modified for the Global Commission. And then our outcomes are changes in attitudes or behavior, health benefits, harms, and costs. Narratively synthesized, where there's a chance to do meta-analysis, we will. Assessing risk of bias with ROB2 for experimental studies and Robin's Eye for observational, and we're using GRADE for certainty data. So very much a fulsome systematic review. Not really, because we had the benefit of time with this one, we didn't really cut corners on this one for rapid review methods. I would say this is more reminiscent of a traditional full systematic review. So this is our full framework of strategies to misinformation that we've been working from. So we've used this to organize the interventions that we've identified from the synthesis. The descriptions are up here in terms and their purpose. And this is how we've anchored our synthesis in terms of findings. So anything from monitoring and fact checking, so timely exposing misinformation, counter misinformation campaigns, which is a bit more active, using credibility labeling online to signpost credible evidence sources, using education or curation, or using some more narrative in form of public condemnations of misinformation to address it. Technical and algorithmic approaches from human learning to machine learning. So that's a new and emerging piece, obviously. Economics, we could be using advertising bans, demonetizing specific content, legislative and other policies. So it could be criminalized acts of misinformation, or investigative. So examining instigators, degree and means of spread, and money involved. So a full spectrum of kind of degree of how intense these interventions are. So with that, I'm going to turn it over to Marcela. So Marcela, do you just want to let me know when you want the slides changed, and I can do that here?
Super. Thank you, Mike. I am super excited to be here in the CHEPA seminar. So good afternoon to everyone. And thank you, Mike, for this invitation to share this presentation. So far, we have reviewed almost 2,400 articles, and we have included in this living evidence synthesis 30 papers. So the next one, Mike, please. So this is a tree map that shows different categories, and depending on the number of articles addressing all of those categories, so you can see that the box is bigger or not. So most of the articles that we have included are experimental randomized studies, 41. The other ones are machine learning based approaches, implementation research, quasi-experimental studies. It's like the universe of the studies that we have include. The next one. The countries that we have that are where are conducted the studies are principally in the US. 25 studies were conducted in the US, but we have identified papers from all continents, different countries in America, Africa, Asia, Europe, and even Australia. And some papers, 9 papers, are online, that they are not limited to a geographic region. They are only made online without differentiating which is the country that they are performing the study. The next one. The topics are mostly COVID-19. From the 60 papers that we have, including the living evidence synthesis, most of the papers were published in the last 20 years and principally in the last 5 years. So most of the papers are addressing COVID-19, followed by vaccination, excluding vaccination for COVID-19, for papillomavirus and another virus, and different health topics, but most for COVID-19. The next one. And the strategies that were identified in those studies are principally educational, monitoring and fact-checking, technical and algorithmic, credibility labeling, and counter misinformation campaigns. And only a couple of the studies have addressed narrative, economic, and legislative strategies to address misinformation. And I want to clarify that some studies addressed more than one strategy for misinformation. So if you make the additions, you are going to see that it's a little bit more than 60 papers. The next one. So here we are presenting the results for each of the strategies that we have studied in this living evidence synthesis. In the part, at the below of the slide, you can see that we add the number of studies that we identify for that strategy, the countries that were conducted the studies, the conditions that were addressed in those studies, the design of the studies, and the number of participants that were enrolled in the studies that we have for that strategy. Because this living evidence synthesis has this scope to make some analysis with a gender perspective. So we always have the number of women that were enrolled from the total of participants of those studies that we synthesize. So here, for monitoring and fact-checking, we had 26 studies. Overall, this strategy was effective in stimulating intentions to take protective actions when compared to not providing these corrections. It was also found to have an effect in the beliefs that people have about misinformation, and it has also an effect in the willingness to share that misinformation. So the studies also report that the positive effect of monitoring and fact-checking is stronger when the fact-checking, when the source of the fact-checking is provided, and even better if the source of the fact-checking is a university that is who is in the media. The format of the correction does not make a considerable difference in effectiveness. And it was also found that the humorous corrections might produce more attention to the misinformation texts that are trying to be fact-checking, but that doesn't improve the credibility in the correction. And there are 2 studies that explore the familiarity backfire effect. That effect is one that is discussed in the experimental randomized studies, because most of the experimental randomized studies come from behavioral science, and it's an effect where if you are trying to fact-checking misinformation, you can expose people that were not previously exposed to misinformation, and maybe when you are trying to correct the misinformation, you are exposing more the people to misinformation. So there are two studies that explore that effect and report that corrections that exposed participants to novel misinformation did not lead to stronger misconceptions compared to people never exposed to false claims or corrections. So that in this case, that is the findings show that we can do this fact checking in these cases. The next slide, please. Regarding counter misinformation campaigns, we found 5 studies. Overall, the strategy was effective in stimulating intentions to take protective actions and improving the knowledge about a health topic and in reducing the beliefs in misinformation. We have here 3 studies that show some of the findings. In Guatemala, one study in indigenous Maya communities found that a misinformation campaign delivered through videos have an effect of almost increasing 2 times the odds of getting vaccinated compared to people that weren't exposed to the misinformation campaign. And in Canada, one study that was performed in Toronto and Hamilton area, also with misinformation campaigns through videos, found that those videos increase the knowledge that South Asian young people have regarding the COVID-19 vaccination. And also in Zimbabwe, a different study found that a misinformation campaign through message to WhatsApp also increased the knowledge about COVID-19. The next one. About credibility labeling, we found 6 studies. 4 studies are randomized experimental randomized studies, and 3 of 4 report not evidence of effectiveness in improving the ability to critically evaluate a given message or in the accuracy in identifying misinformation. Only one study in the US reported that fact-checking labels attached to misinformation posts made vaccine attitudes more positive than the misinformation control condition. And especially when the labeling, as I explained before, for fact-checking is more effective when the labeling is performed by universities and health institutions. And also 2 studies of machine learning based approaches found that those strategies are successful to classifying reliable information compared to unreliable information. So the machine learning study says that credibility labeling are more useful to classify the reliable information than to classify unreliable information. The next one. About educational strategies, many studies were addressing this intervention, 26 studies, and overall the strategy was found effective in changing the beliefs of people exposed to misinformation, improving the knowledge about a specific topic, changing the willingness to share misinformation, and enhancing the ability to discriminate that misinformation. We differentiate the findings from studies conducted in the US and studies conducted outside of the US. So here we had 20 experimental randomized studies. 8 were conducted in the US, and those studies in the US found that educational strategies are not effective for stimulated intentions to take protective actions when it's compared with not providing that education. But the studies that were conducted outside of the US, that were 12 randomized studies, found that the strategy was effective for the same outcome. So the following point maybe is a small explanation for this. So there is one study in Italy that reported that among participants with higher levels of conspiracy mentality, those people that are exposed to counterfactual, pre-banking, educational strategies, they are less sensitive to change their ideas that they have about misinformation. We also find that one study reported that the news literacy messages can alter misinformation perceptions and belief, but when you are implementing educational strategies, a single message is not enough to help to alter the misinformation perceptions in the participants. And another study found that educational messages were more persuasive when delivered by a non-expert, and that an expert speaker increased the persuasiveness of a videos only when the evidence that the expert present is statistical evidence. And here also there is a study in Australia that more or less was studying the same phenomenon about familiarity backfire, that is trying to identify that even when you are repeating myths to try to debunk the misinformation, these educational strategies doesn't increase the perception about misinformation. The next one. And so narrative strategies, we only found 2 studies, one conducted in China, one conducted in the US. The one in China shows that the follower count, the number of followers that a celebrity, the media, or the government has in the median account has an important effect in how people decide to sharing misinformation, counter misinformation strategies. So that the number of followers is super important to when people decide if they are sharing or not misinformation, a counter misinformation message in the media. And another study in the US showed that the advertisement for Facebook that provide videos with testimonials from peer roles, that most of them were celebrities, they have a most important effect in changing the ideas about misinformation than when the advertisement videos in Facebook came from the CDC. So that is more effective from the narrative perspective to have a video from celebrities than from experts from the CDC. The next one, regarding technical and algorithmic, these kind of strategies are mostly used to identify misinformation that is available in media. So we identify 7 studies. 6 of them are machine learning studies that reported the effectiveness of different models of in identifying misinformation. And principally, this is with chatbots that the studies have shown that the chatbots are very good in answering questions, in achieving an overall accuracy in the answers that they provide to the people that are looking for information in the media. And they also have used these technical and algorithmic approaches to see if providing counter misinformation in Reddit or in Facebook or in Twitter make a change in the beliefs that people have in previous misinformation, and have found that these technical and algorithmic are effectiveness for this kind of strategies. And the next one is economic strategies. We only identified 2 studies. Both studies found that the financial incentives might not have a beneficial effect in reducing the willingness to share misinformation. One study in Hong Kong found that those financial incentives have a stronger impact on attracting readers to share healthcare misinformation that they perceive to be fake. And it was interesting because that study showed that financial incentives can have contradictory effect. So people doesn't share the right information, but they are more, they have more reasons to share misinformation. Okay, and in the UK, there is also a study looking for this kind of strategies of financial incentives. That shows that participants that receive those financial incentives were not able also to identify the validity of the scientific claims that are in that information. And the next one, this is legislative and other policy strategies. We only identified 2 studies, and one study in the Hong Kong conducted online found that financial incentives and legislation, they have a not benefit in trying to counter the dissemination of misinformation. So this is like the principal findings for each of the categories. I think, Mike, that maybe you can close with the next slide that presents all the conclusions with all the strategies that we identified.
Do you want me to cover this, Marcel?
Yep.
Okay. This is our first time presenting these results, so we're just sorting out who's saying what. So this is just our overall summary. There's a lot in there, and we of course have all our detailed data extractions and so on about each of the interventions that we'll be posting publicly once we have this first version finalized. But our conclusion is just that overall we found that compared to not providing any form of intervention, monitoring and fact-checking, counter misinformation campaigns, and educational strategies are effective in stimulating intentions to take protective action. So that's intentions, not necessarily actions. And also changing the beliefs of people exposed to misinformation and reducing the sharing of it. So that's an actual behavior. Economic narrative, legislative, and other policy strategies, we're not finding any sort of evidence for beneficial effects in reducing the sharing of misinformation. Whereas credibility, labeling, and technical and algorithmic strategies are found to be effective, but we still need some more evidence, I think, on this side to make some more robust conclusions. And we don't really have anything about curatorial or investigative strategies. So those are our kind of bottom line statements for this. In terms of next steps, then we can open up for questions. We're going to be moving soon to hopefully publish our report. We're just waiting for review by all our co-investigators. It'll be available through the forums website and through the Global Commission on Evidence. We'll be disseminating to our project partners and wherever else, all our affiliated social media folks that we work with. We're also going to be now starting on producing a new separate product about addressing misinformation related to political institutions. So this came up from the request that we tackled from the Privy Council office. We were doing the one about health-related misinformation. But there's another parallel question about what about misinformation about governments, elections, policies, all these things that can potentially undermine trust and accountability for our institutions. And then one that we're not addressing but has come up in requests is about marketing, misinformation disseminated through marketing campaigns and so on. So that we feel like we're probably not the best ones equipped to take that one on, but I think it's another priority for another lens on misinformation that is important. We'll be producing probably the first version for the political institutions at some point in the first half of this year, and then running the update for this health-related misinformation one, likely for June 2024. We're also trying to figure out how best to publish findings for these. As you can imagine, publishing findings for a living evidence synthesis, you need a journal to say, we'll publish your first version. But for me, the most efficient way to do that is to have that publication there, searchable, but to replace the publication with the most updated version. And that's a new way for journals to have to tackle this kind of stuff. There are a few examples of this happening, but my hope is that we see it become more common as we go forward. So that's it, and happy to take some questions. I can maybe expand the tiles just in case there's anyone online who has a question. So if you do, feel free to use the raise your hand function and let us know if something crossed your mind and you wanted to ask, plus anyone in the room. So any questions from Marcela and me about this project?
How come the disinformation, like the financial incentives was for this, like for this inaccurate information? Why that made it more like these financial incentives that made it more,
Sharing
yeah,
profit.
sharing more, yeah.
Marcela, did you
Incorrect
hear that?
information.
You know the ins and outs better than I do, but just looking for the financial slide to hone in on it.
I didn't hear the question.
So Laura asked the question, why was the financial? Oh, economic strategies. Why was the financial incentives, you saying stronger for
Sharing information.
sharing information? What, do you have any thoughts on that based on what you read from that particular study, Marcela?
Yeah, so that study give money to people to read some information and decide if some tips to identify which of that information is misinformation is wrong and where is right. And in that study, they pay to the people to make a good decision about that information and to decide if share that information or not. And when they were paying for given that financial incentives, they found that people improve a little bit the skills to identify the misinformation, but they still continue to sharing that misinformation, and that even when they identify right information, they decided not to share, but when they see misinformation, they decided to share that misinformation. So that is why that study found that the effects are not positive for reducing the sharing of misinformation.
The question looked like you had.
No, so first, thank you so much. That's kind of super interesting and super important. No, I was thinking about that. I was wondering if it was a type of financial incentive, right? Like also provide this type of response. But looking at your slides, a lot of stuff seems for me that chatbot, AI, represent, it's kind of cheap, easy technology, and it's getting better to address misinformation and can be fast, cheap, but so sounds for me like, what it took from all of those.
Well, I think that's big, right? Because the propagation of misinformation is rapid and everywhere. So, and to keep up with manual approaches, I think you can't keep up. So I think it's gonna have to be complemented with that kind of thing. And if we are, and as things improve, I mean, it's gonna improve on both sides.
Yeah.
But as things improve, we can at least take what we've learned from some of the other educational credibility labeling and use the chatbots and other things to do that more rapidly than we ever could.
Another thing you say was, 87% of the time it was correcting or identifying the misinformation and correcting it, so all the time is going to go more. So something I was thinking, I was looking at might be related to the strategies, like, it seems like mostly it's like, you look at English papers, right? And so a lot of them went to US, a little bit all over the place, but I was wondering also,
But we didn't limit to just English. So we didn't limit to just English. And then for this version, we were able to process any papers, 5 or 6 different.
Because I was looking Embase, Medline, a lot of this stuff are mostly English, English or European journal. But I think there's some databases from South America, there's maybe some from Eastern Europe. So maybe in the future something to be
done. So certainly if you're learning, it's something that Marcela's her first language is Spanish.
Well, that's what I was thinking,
So that's probably a great thought for expansion for searching some other databases, not just English focused.
Yeah, I was thinking, English, Portuguese, or Spanish, Portuguese. I was thinking a lot of stuff in Brazil, as it came to my mind in terms of misinformation, not just COVID, but about, climate change. That would be a big one also.
Yeah.
Very well, thank you so much.
I think I saw Anya's hand up. Yeah, so Anya, a question? You there?
Anyone from our students in the room?
I think Anya has her hand up. Anya, are you speaking? Because if you are, we can't hear you.
And just not.
Anita?
Yeah, she's off mute, but we can't.
Can you hear me?
Yes, I can hear
Hello?
you now.
Oh, I'm so sorry about that. Thank you for being presenters today. Actually, our study is quite timely. I believe today our several leaders from across the world are meeting to discuss disease X and misinformation and how to combat future misinformation. And so I'm wondering, your findings, could they be reframed as information trust? In other words, how can we potentially use these findings to build information trust as opposed to conceptualizing it as combating misinformation and disinformation? Is it possible to reframe your findings as building information trust? Just curious.
And so thanks for that, Anya. I see your point. I guess the main reason for me wanting to stick with misinformation is that is a very common term and easily recognizable, and in terms of kind of people seeing that term and the relevance of this evidence synthesis to a topic that is labeled as misinformation in global economic and other social policy forums. For me, that's the hook to have this get visibility and traction in terms of use. But in terms of a positive framing, I don't disagree. And we can certainly weave that into some of the framing of the results around, like, the intent is to build information trust through this as a mechanism of addressing the problem, which is misinformation. Other questions? Anyone in the room? Just checking the chat. Yeah.
I think it kind of builds on what Arthur was saying earlier, is that part of the challenge you're going to have is you're going to have this core group of people who just aren't going to be willing or able to update their perspectives. So they believe what they believe, and so they sort of pull out the information that supports their beliefs and discards any information that doesn't. And that is part of that process where misinformation gets propagated, because these people so fully believe in their perspective, and they believe all other perspectives are incorrect.
So that's a great point. And I think what I want to think about this on is on a spectrum of people. So you've got people who aren't going to move, and I think that's the case in really any social policy intervention, right? You're going to have people that are stubborn to change no matter what. But in this case, we're also looking at misinformation and the effects on health and behaviors. And so what we're interested in is not people who are entrenched at the end around everything evidence-based, not people entrenched at the other end around let's undermine social policies and institutions, but all the people in the middle who are seeking reliable information and are relatively, can be easily misled with information that is put out there that could verifiably be labeled as misinformation. And so if you think about that with the vaccine example, you've got a bunch of people who questioned but hadn't made a decision about vaccines and whether they're safe, effective, or so on. And they turn to find information to make a decision. They turn to family and friends, they turn to online information. So what can we do to ensure that the information that they encounter in making those decisions is going to be high quality, reliable, and not someone who's taking and twisting facts that's in a document? Because what we see in misinformation is that the people who will spread misinformation will take a document that looks credible and disseminate conclusions from it that are not consistent with that were in the actual document. So you need to pick, you need to be able to say, look, this document that this person is talking about, those are actually not the conclusions that were formulated from. So for me, it's that group in the middle where we can have a verifiable impact on important public health and other healthcare related outcomes by addressing misinformation. So that, I hope that makes sense in terms of where we're coming at this for a utility perspective.
So the first part of that then is that your first step is trying to help people in the middle, being aware that there's really not at this point anything that you can do to those people that are so fully entrenched in what they believe.
Well, I think it's a slightly different question. I don't think we're coming at this as interventions to eliminate misinformation. We know it's going to be out there. What can we do to address the information that is out there to help those that are seeking credible, reliable information to make a decision about their own health or choices that they may make about a treatment, seeking healthcare, getting a vaccine, whatever it may be, so that they get the reliable information versus some of the other stuff. I don't think it's reasonable to think that we could eliminate it. That's not possible, but what we can do is try and make it easy for the reliable stuff to pop up and to be, or for people to assess it, help them make those kinds of decisions. Yeah.
So the credibility of experts, like the CDC, she made the comment, or Marcela made the comment that they didn't believe stuff from the CDC, but they would believe stuff from celebrities. So Taylor Swift is a vaccine advocate, so presumably she's got more influence on some people than Dr. Fauci. How do you address the credibility of, I mean, this is what you're supposed to do, but the credibility of experts, like how does that factor into this?
Good. Yeah, well, that's challenging on several fronts. So in terms of experts, I mean, even during the pandemic, you hear recommendations and expert panels. It's hard to know which of the panels actually made recommendations based on evidence. You can see all these consensus panels generate recommendations, and there were absolutely no evidence inputs to them whatsoever. It was expert opinion. And somehow that outweighed doing that alongside kind of best available synthesized evidence. So that's one sphere of that, is that I think we also have to question what's reliable from expert opinion as well, and do a better job of generating recommendations that are informed by and that use evidence to make those recommendations, rather than just a bunch of guys sitting, I'd actually say guys sitting in, or old guys sitting in a room making recommendations based on their collective experience over decades. So that's very different than doing so by informed by it. And then the other is what you're pointing to with how do you use a form of dissemination through someone that people trust socially, not just an expert. So for some people that might be Dr. Fauci. Like, I'm going to look to CDC or other heads of this, and they have trust, and that's great. But other people want to, whether you're looking for your key followers on Instagram, there's a reason why we call them influencers. Like, this is an important source of information for people. And I think one that we need to think of how we use that in a way to combat this. There's going to be coming from other sides as well. So it's not really an answer, but more of a maybe making it more complicated than what you asked as well.
In parallel backgrounds, there's also campaigns, to discredit Fauci.
Well, campaigns to discredit elections,
works mostly for,
so
right, so in terms of trust, right?
it's very sophisticated. Yeah.
The question on, you're talking about discrediting elections. I think there's a long history of trying to discredit elections.
Yeah.
And the issue is whether it's justified or not. I mean, we have election observers in lots of different countries around the world. And sometimes they say, with evidence that I believe, that the election was not credible. And sometimes they say that the election was credible, or sometimes they say it was in between. And it large part depends on your trust in the election observers. I mean, Jimmy Carter spent a lot of his life, not post presidency, being an election observer in lots of countries around the world. So it's actually not like right now we're all focused on the US, but actually it's a big question around globally. And
Well, we
it's
have
not
it
clear.
happening domestically.
Sorry.
So we have the examples domestically
Yeah.
with the interference from China through a local MP, I believe, in Mark.
Yep,
Example of that. You have Russian interference.
We have a lot of other, Well, take a look what the United States has done in a lot of elections. I mean, or Canada. Canada has interfered in a lot of elections around the world. I mean, it's actually really tricky, and we like to say we all have our pet things, and I just like to observe that I'm a biased person.
Well, I think we'll need to acknowledge our biases, and I will never say that these are straightforward or easy questions to answer. I think they are worthwhile to try to answer.
No, they are, but it's always fraught,
Yes.
because there is no agreed upon truth for some of these questions.
And sorry, Lisa, I see you have your hand up.
Yeah, thanks for that. And I'm sorry to disrupt the conversation. I guess I'm wondering a couple of things. One is when you're transitioning from talking about health information and misinformation to moving to the political realm, as you're talking about doing, do you anticipate and will you be working with other people who have a different sort of knowledge and skill set? Because I just wonder what the differences are between managing health misinformation and managing political misinformation, if you anticipate there are any at all. But a bigger question for me also is around there's misinformation, there's information, and then there's the uncertainties that that circulated. And part of the problem during the pandemic especially has been uncertainties leading to what looks like equivocal or maybe weak communication strategies of changing their minds. I mean, I remember with the masks particularly, people said, this week we're told we don't wear masks. Next week they're telling us we need to wear masks, and people actually saying to me, they don't know what they're talking about. And I'd heard somebody saying that if early on they had come clean with their uncertainties, if public health specialists and politicians had said, we just don't know, but we're giving you the best information we have, that would have led to less breakdown in trust. So I'm just curious to know about uncertainty and where it plays a role in some of the work that you've been doing, which I think is also really fascinating and helpful. Thanks.
So those are great questions. So for the first one around political institutions, I mean, John Marcela and I bring some of the expertise in that area, but I agree, like we're just starting it now. So I think, we have some political partners on this as well, so they'll bring some insight for it, but I think we need to think strategically about who else we need to engage as some subject matter experts in this area. For your second question around uncertainty of evidence, absolutely. I think we need to be, part of being transparent is labeling uncertainty when there's uncertainty. And part of your comment, I think, was around political communications versus science communication, and those are separate but also overlapped in some ways. So for the science communication, I think we can do a much better job of trying to convey what is uncertain versus what is also best available. So as an example, where I coordinated a suite of 10 living evidence syntheses about different public health and social measures, which included masks that Marcela and I are now leading an update for. And so you're never going to get randomized control trial evidence for population level masks because it's just impossible. You can't randomize people now to masks. So what is best available are observational or other ecological level studies that we have. And we need to be clear about that in the assessment of evidence, that we can't expect to get more certain evidence, and our conclusions are likely not to change from it either. So it's that part of that is the science communication and doing a better job of not classifying studies and assessing studies only with the clinical lens, and instead using a different lens that is relevant to the field being studied. So saying grading evidence as only certain if it's a large randomized control trial just isn't helpful for public health and social measures because you're never going to meet that metric. But the other is political communication. I agree. I think, part of this, I think that was come up is about building trust. And that was Ania's point around, can we frame this around trust building? And sure, I think the politicians, this is just my commentary, but I think they were struggling with how to assess and make decisions, and there were political considerations coming in play. And I think some of that eroded trust. And that's a big part of this.
Thank-
I think also part of that is people don't understand the words that are being used.
Yeah.
So from a clinical perspective or from a science perspective, talking in statistics, they don't understand what that means. They're seeing it as a bad point. You get the vaccine, you don't get sick, you get the vaccine, you get sick, but there's this whole gray area. And I don't think that was well communicated.
Well,
And
all
there's
the more
gotta be
reason for
better
this
ways.
priority.
Yeah.
Yeah, because, I think we need to do a much better job of citizen engagement, not just in dissemination, but informing questions that are being asked and putting together results and then disseminating in plain language materials that people understand. That's our next step for this synthesis as well, is to, but we have 4 great citizen partners to try and unpack this in a way that's going to be common to citizens.
So.
Yeah. Marcela, anything else to add? Then we can probably wrap up.
Yeah, Mike, given the questions, I think that overall what is happening with this evidence is that researchers are trying to find which are the best strategies to shield people against misinformation. So it's like for example, the educational strategies are they are not for providing information. They are for helping people to develop skills to identify what can be misinformation, how to go to search in the website for the real information, try to see how to make a fact checking of something that they were exposed in the media. For example, with the people that has this conspiracy mentality. So it's like the researcher says, they are not a big proportion of the population. They are small groups, so we can develop strategies for most of the people and in some way understand that some people, they are not going to change their mentality, but we need to try to help the other people to identify that this information that is disseminated in the media is not right. And the other thing that I think is important here is that some of those strategies, the counter misinformation strategies, are also considering the availability of new approaches like artificial intelligence and that kind of stuff to try to identify in a short time, in a massive way, how to stop misinformation in the first steps of that situation. So I think that, yeah, it's like looking for the best strategies to help the people to make a judgment about the information that they receive.
Thanks, Marcela. I think we should probably wrap it up there.
Yeah.
So thanks everyone for having us.
And thank you, Marcela, and thank you, Mike. That was great.
Yeah, it was excellent. Thank you.
Yeah,
That's
that's
very
great.
interesting.
All right, thanks everyone online. So thanks for joining.
Thank you.
And Mike,
That's
just to
fantastic.
hit end on this.
Yeah. Yes.